So, menopause and nutrition, what every woman above 40 needs to know. I know that my host did introduce me, so we will just go right into it. So wellness is a journey, no matter what age you are. It's not a destination. It's not a bus stop. It's a journey. And I think that many times we forget that we are working constantly on this journey, which means that it involves intentionality, it involves awareness. And the more you are aware about your health is the more that you can practice on this journey. This slide, I will encourage you to take a picture of. It's called the Wellness Tree, and it was inspired by my husband, Dr. Patrick Ejawari. And this tree really represents your body holistically. It has the root of the tree, it has the bark of the tree, the body of the tree, the branches, and the leaves. And what I want you to zone in on is the roots. So on the bottom, there are 5 main roots to this wellness tree: spirituality, which involves forgiveness, peace of mind, gratitude; your mindset, which is like your mental state, your mental well-being, your psychological state. How are you programming your mind to approach menopause? And then, of course, we will zone in a lot on nutrition. And nutrition really is nourishment from the inside to the outside. And it involves both the spirituality, the mindset, the lifestyle, the environment. And we will dive deeper into that as we go on today. And then, of course, lifestyle, your movements, whether you're dancing, whether you are walking outside, just movement in general is life for the entire body. Environment, your home. Are you happy when you go home? Your work. How are you at work? Are you stressed out at work? Your environment of cleanliness. Do you feel peace when you're in your space? And we tend to say that if these roots are imbalanced, that's when there's chaos within the body, whether it's from the food that we're eating, whether we're not sleeping well, and different ailments tend to show up when there's chaos or when there's imbalance. And it could be diabetes, it could be allergies, it could be heart disease, high cholesterol, obesity, metabolic syndrome, could be autoimmune disorders, depression, kidney disease, liver disease, ulcers, stomach problems. I mean, the list goes on and on and on. So our aim is to really help to impact you and help you to understand this journey and how we need to be intentional and actively participating day to day on the journey of wellness. Okay, so just a quick summary. We all know, I'm assuming, that there are different stages of menopause. I just met a lady yesterday, and I think she was 33 or 35, and she said that she was in menopause. And I'm like, that's not possible. She started her period at age 9. And then I realized that, okay, maybe there's a possibility because, of course, the earlier that you start your period is the earlier that you'll go into menopause. Now, there are shifts in the hormones, estrogen, progesterone, testosterone, and perimenopause is basically the transition phase into menopause, which can start 4 to 8 years before you actually stop getting your period. So your cycle length begins to change, and then other symptoms, maybe hot flashes, insomnia, start to occur around the age of 43 to 51. But here's the mistake for some people, like the young lady that I met yesterday. She was having a lot of nutrient deficiencies, and so it's showing up as a perimenopause, menopause. She had PCOS. She had so many different issues going on that it mimicked the perimenopause phase, but she's not there yet. It's just deficiencies happening. So by the time you get into menopause, you've actually stopped menstruating for 12 months. You're considered to be in menopause. People who have not menstruated for several months but haven't yet met the 12-month benchmark often refer themselves as going through menopause, but it's not until you've been 12 consecutive months with no period, then you've entered. And then the postmenopause, this phase begins once you've completed menopause or gone through 12 months without menstruating. Now, there are changes associated with menopause, and I will say that not all women go through these changes. I've met quite a few women who said they're just embracing and waiting for the changes to come, but it doesn't necessarily have to be the same as what other women are experiencing. So some women experience hot flushes, night sweats, changes in the regularity of the menstrual cycle, vaginal dryness, pain during sexual intercourse, and sometimes incontinence, difficulty sleeping, insomnia, changes in mood, depression, and/or anxiety. And these symptoms are quite common. We'll cover a couple others, but I just wanted to give a summary of what it really associates with. There are also nutritional changes that happen during perimenopause, and these nutritional changes we see over a broad spectrum of women. So you find that one, they're not having enough nourishment, not having enough micronutrients, the vitamin D, the calcium, the B vitamins, the zinc, the magnesium, the iron. And all these actually support hormonal changes that occur during the menopausal period or the perimenopausal period. We find that calcium and vitamin D, of course, supports bone health. Vitamin E also drops after menopause. So ensuring that you are really building up your nutritional baseline. Nutrient gaps can occur during the menopausal transition for various reasons. It could be age, it could be lifestyle, it could be digestive health, and the impact of lower estrogen levels on the host of bodily functions this hormone supports. So if you're having gut issues, digestive issues, bloating, constipation, not having enough energies, all of this is stemming from your gut health. And once you improve your gut health, you find that the overall body and hormonal changes rebalances out. Of course, we say during this nutritional change, eat more protein, make sure you're on top of your omega-3 fatty acids, your fiber, your calcium, limit it and eliminate saturated fats. That's like oily foods, fried foods, fatty foods, highly refined carbs. Those days are over. And definitely sugar. Cut out the caffeine, cut out the alcohol. And I know that as I've consulted with many women, sometimes this change is really hard. And I guess as one goes through the journey and you realize that, okay, some things just have to go, you just have to come to terms with it. Once you come to terms and you start eating healthy and clean eating, you tend to feel better. Because I do know a lot of women tend to crave sugary foods. They tend to crave things like Coke Zero or mineral drinks or maybe alcohol to help them to sleep. And really, it's just kind of causing a lot of havoc within the body. Now, signals and concerns. Of course, the hormonal balance is as it affects estrogen, progesterone, the adrenals, the thyroid glands, all of them signal to each other and work with each other. So your brain health, your bone health, your uterus, DNA, breast, libido, all of this is affected by your hormones. And so our approach, especially at Carib Health, is an individualistic approach. I know that there was a question that came from the group about one size fitting all. It's not a one size fit all approach. And when you go to the doctor, you'll actually notice this. Sometimes the doctors don't even know what's going on with you, and you're going through a mirage of tests. Meantime, it's just the perimenopause, menopause kicking in. So some of the questions that we ask, especially in consultation, would be, what exactly are you going through at this stage? Is it in your personal life that maybe some challenges are coming up? Is it marital life? Maybe you and your husband are not seeing eye to eye on things. Is it your children, your teenagers already going through their own trauma or drama, and that's stressing you out, which also directly and indirectly affects your baseline nutrients? And then also asking the question, how do you actually respond to stress? Because though this webinar is on menopause and nutrition, stress actually affects your nutrition. So when you're under stress, and as I mentioned, whether it's personal, maybe somebody passed away, whatever the case is, your nutrients get depleted when you're under a lot of stress. Your cortisol levels are high, your B vitamins get mopped up very quickly in order to help you to deal with what's going on. So taking time out to really understand our clients and how they respond to stress and what's going on in their life, what's their lifestyle, how can we help you rebalance your lifestyle? Are you sleeping well? What's your food intake? All of these take in a big consideration in your overall health. So some of the signals that your body gives you as you go through this perimenopause, menopause period, it may be weight gain, it may be increased central fats, which many women can relate to, having lots of abdominal girth in the top region, where I think they call it like a muffin top. Or you may have it in your hip region where the fat is just distributed a bit differently. You may also have metabolic syndrome, hot flashes, sleep deprivation, and you just may be sedentary because that's what your job entails, that you sit down all day. So being intentional and aware of what to do, how many times you need to get up, just making that intention known to yourself. Because if you don't do the work and change your lifestyle, there's nobody else that's doing it for you. And then also we see signals and concerns of decrease in muscle mass. And of course, we want you to use resistance training. That would be most beneficial. So that's just summarizing like menopause, perimenopause, and then asking yourself probably twice a year, what is the current state of your health on a medical level, on a nutritional level? And once you cross the age of, now I'll say 35 to 40, you definitely need to make sure you get your yearly checks, biannual checks, which means that you go to the doctor twice a year. And health is wealth. You want to just make a point to do this for yourself so you know what your numbers are reading, and then you're not surprised when results show up for you. So our outline today is going to cover hormones, symptoms, causes, nutrition and imbalances, how to get rid of xenoestrogens, and practical tips to keep balance. So basically, you have different hormones within the body, and these hormones are chemical messengers which are produced by the endocrine glands. And as you can see, the endocrine glands there, which are specialized tissues that release these messengers directly into the bloodstream. So it will send signal to the pituitary gland, to the pineal gland, to the hypothalamus, that will then send signals to the pancreas, the thymus, the thyroid, the adrenals, which also send signals to the ovaries and, for male, the testes. And so, let's go back. So the different hormones, for example, you have the insulin hormone, which is produced by the pancreas, and it regulates your blood glucose level. You can see the pancreas there right below the lungs. And then you have the thyroid hormone, which is produced by the thyroid gland, and it regulates your metabolism. So when you go to the doctor and they do the T3, T4 tests, the TSH tests, thyroid stimulating hormone tests, just to make sure that your hormones are within the regular baseline or within the regular range. It's quite important. And then you have your estrogen and testosterone, which is produced by the ovaries. And it regulates several your sexual and developmental and reproductive cycles. And then you have the adrenaline, which is produced by your adrenal glands. That's the small square gland that sits on top of the kidneys. So this gland is responsible for your fight or flight. So when you are stressed out, you have to know how to deal with stress because you really don't want to overwork these adrenal glands. All right, next we move on to your gut microbiome. Now, I am a gut microbiome specialist, and this basically means that your gut has trillions and trillions of bacteria, it has fungi, it has viruses, but they all must live in harmony together. Now, some of the foods that we eat can cause a dysregulation. It can cause an imbalance within your microbiome. Some of the foods, such as the 3-in-1 coffees, the Maggi cubes, the Knorr cubes, the artificial sweeteners, all the processed foods, all of this disrupts your gut health. When your gut health is disrupted, you tend to have low immune system. You would have constipation or irregular bowel movements. You may have bloating, flatulence, gas. You're wondering where all this is coming from. You may even have a correlation to arthritis, to joint pain, and this is directly coming from your gut health. Inflammation, low mood, irritability, anxiety, lack of focus, brain fog, headache. You may even have skin rashes, itchy skin, red skin, eczema, acne. All of this is related to your gut health. So once you fix your gut health, and it may mean that you need a gut cleanse, you may need a detox, you just need an assessment with a gut health specialist, so they'll let you know the steps to take. And then once this is solved, then your problems go away and you're feeling better. You even have more energy. Now, on to another hormone, your hormones and your cholesterol. So we absorb cholesterol, of course, from different foods. Your liver is the main production of your cholesterol. So your body makes its own cholesterol, and then we absorb it from outside foods as well. So if you find that you've gone to the doctor and your cholesterol is high and the doctor is saying, oh, you need to be on cholesterol medications, try and see if you can convince them or convince yourself that before you get on those cholesterol medications, you're going to make a lifestyle change. If you feel that you cannot make a lifestyle change, then by all means, go on the cholesterol medication. But know that this cholesterol medication is zapping cholesterol from your entire body, and your hormones are made from cholesterol. Your brain is made from a lot of cholesterol. So once you're put on these statin drugs or cholesterol medication, it's also pulling fat from your brain as well. Before you know it, you're having brain fog, you can't remember things, you're going into early dementia. So lifestyle change is key, especially if you want to live a healthy and active life moving forward. Now, vitamin D is a hormone as well, and this vitamin D provides a lot of nourishment for different systems in the body. Number one, it improves your sleep, it balances your blood sugar, it helps to reverse estrogen dominance. It also helps with hair loss, reverses autoimmune diseases. It has anti-inflammatory effects. And also just to note that sunlight and the skin. So when the skin is exposed to sunlight, it actually converts the epidermal cholesterol into vitamin D3. And this helps the body synthesize vitamin D. So if you're not going outside daily or every 2 days, and we would say between the hours of 10 and 3, that you at least get at least 10, 20, 30 minutes of sunlight, expose your back. Definitely you can have a sun visor or a hat on so you're not like burning your face. But getting daily vitamin D is even better than taking the synthetic vitamin D. There is plant-based vitamin D that's available, but what I would advise is that you go and get a blood test because vitamin D controls so many systems. We find that in our center, those who are seeking for a alternative answer or maybe an alternative treatment, we tend to run the vitamin D levels, the blood tests, and we'll see that those who have cancer, their vitamin D levels always 100% low. Those who have autoimmune disorders, vitamin D always low. So it would be good if you haven't been going to your doctor or you just do random labs here and there, definitely to try and get a doctor that understands what's going on with your body, or if you just want to run general tests, make sure that they do a vitamin D test, or you go to the lab on your own and just go check it yourself. Because I know some people, they're not getting sick or anything, but by the time you get to the point of you're feeling weak, tired, not sleeping well, vitamin D is one of those factors that might be low. So vitamin D is also responsible for bone health. So if you're having bone pain, you're having back pain or neck pain, anything with bone, check your vitamin D. Vitamin D also prevents infections and autoimmune diseases. It's a key to your immune system, vitamin D. Mental health. So if you're having foggy memory, you're just moody, vitamin D helps this. And then it also helps to regulate your blood sugar, your heart health, your blood pressure. It prevents cancer. And then for those who are looking for fruits of the womb, healthy babies, vitamin D also helps with that for your hormonal balance. Symptoms of hormonal imbalances. Before I get to symptoms, let me just make sure I'm not speaking to myself. Are we all together? If you could just give me a wave, that would let me know that we're all on the same page.
We can hear you clearly.
Okay, super. All right. So symptoms of hormonal imbalances. Here are the symptoms, ladies. Whether it's stress, whether it's acne, I mean, any little thing just agitates you. That's a hormonal imbalance. If you're having vaginal dryness, you're having headaches, foggy thinking, you know you've gone in the kitchen for something, you're not even sure what you went in there for, you go upstairs, go somewhere, go to your office for something that you know is important, you get in there and you can't even remember what you went there for. Hormonal imbalance. It could be nutrient deficiency. If you're having difficulty sleeping, hormonal imbalance, irregular periods, weight gain, diarrhea, you're craving food, you're depressed, decreased libido, excess facial hair, body hair. I think the other day I saw a post that said, just driving and once you get into the facial hair, where you're starting to grow some extra hair on the chin, for some women, they have a tweezer in their purse. They have a tweezer in that little key chain holder area, and they are picking hair from their face. Hormonal imbalance, breast tenderness, increased susceptibility to infections. That could also be hormonal imbalance. And all of them don't follow the same trend. So though I'm saying it on the screen, it doesn't necessarily mean it's definitely a hormonal imbalance. It just needs to be checked. Someone said, what is hot flashes? If everyone else in the room is cool and you're sweating, that's called a hot flash. If you're having night sweats, you're fatigued, you're frequently urinating and you're not sure why. Infertility, dry skin, mood swings, insomnia, depression, changes in appetite, hair loss, sweating, deep in voice, sore breasts, swollen, puffy face, headaches, bloating. I mean, there's such a long, long list of what the hormonal balances could be. But definitely to just keep to this and make sure that you get this. Some of the causes of hormonal imbalances could just be your busy work schedule. You're working too much. There's no balance. You're not taking that break for yourself. Maybe there's some social pressures, whether it's keeping up with the Jones, whether it's just going out and well, they call it now FOMO, fear of missing out. It could be death or separation of a loved one. That's a major, major, major trigger for hormonal imbalances and cortisol level changes. It could be life changes, just that moment of realizing that you're getting older and you're not even prepared. Parenting stress, whether it's from your own parents or maybe from your children, health problems. So basically, I'm just highlighting the different triggers that stress can put on the body. And it doesn't have to be sickness. It can be other things that are triggering the stress. And I'll share with you how to deal with those stressors. I want to just highlight xenoestrogens. And xenoestrogens are these are toxins that imitate estrogen and can dramatically increase toxic burden and estrogen dominant symptoms. So you find that you have things like the plastic bottles, it may be nail polish, it's a lot of things. And this is not to overwhelm you, but just to bring to your attention. Make sure that you're reading ingredients. There are certain synthetic ingredients, certain foods or just ingredients that are not natural, chemicals that make up bottles, make up dyes, make up coloring, make up colas, and these can mimic the estrogen in your body. So yes, your estrogen may be decreasing small, but before you know it, these xenoestrogens, which mimic the estrogen in your body, can actually cause an estrogen dominance. And this estrogen dominance is not a good thing. So there are certain foods that help to mop up this estrogen dominance, which I will share with you shortly. Another thing that we find in the xenoestrogen group is things like the pesticides, the herbicides, the dry cleaning chemicals, and it's just making you aware of how we've industrialized things. And yes, we're living in a fast-paced world and we just need to take our time and maybe air out the dry cleaning clothes. Maybe look at the ingredients of the pesticides that we're using. When are we using them? Are they in the room? Those mosquito sprays that you spray in the air and spray underneath your children's bed or spray under your bed, do you immediately go back in the room? Do you wait for an hour or 3 hours before you go back in the room? So these are some of the things that are also affecting our wellness. As I mentioned before, the different factors affecting our hormones, stress, our gut health, the toxins, our nutrition, our lack of exercise, lack of sleep, all of these holistically affects our hormones. And then when it comes to foods, foods that we feel like we are so addicted to or can't let go of, or it's the enjoyment mode. We just have to change our mindset and be in that mode of what we're doing today is what's building our body for the next 5, 10, 15, 20 years. So the fuel that you're putting in today is what's really the building blocks for the next couple of years. And it's, that mindset where you have to think that, okay, I've been there, I've done that. I had that in my younger days. Now that I'm moving forward, the donut, the chocolate, the sweet tooth that we say we have, the milk, the breads, we just have to let that go, because if you don't, you'll constantly have these symptoms. And before you know it, you will have a pharmaceutical bag going to the doctor's office. And this just the reality of knowing that whether it's Gen Z or our generation of children today, they don't want to get stuck with taking care of us. So we actually have to make sure that we're taking care of ourselves. And it's not about blaming the husbands or blaming anybody else, but making sure that you are responsible for what you put in your mouth, what you put on your body. You're just doing the best that you can to keep yourself healthy. As we can see over the years, how food has really changed. You see the chickens on the top of the screen. 1957, this is what the chicken looked like. From 2005 and beyond till now, the chickens don't even move in the coop. They stay in there 24/7s. And now they're given growth hormones, they're given antibiotics, and you can imagine that these meats and chickens that you eat, whatever it is that they've been fed, we indirectly eat it as well, because once the birds or the cows or whatever are ready and they go to the abattoir and then we cook them, those chemicals that they've put in there to fatten them up in 2 months or 8 weeks or 3 weeks is what we also ingest. So knowing where to get your organic foods from, your guinea fowl, your grass-fed cow or your grass-fed goat, or just knowing that your cow wasn't fed with all these growth hormones and antibiotics, and neither was your chicken. You're going with the free-range chicken or the guinea fowl. And then also the awareness of what disrupts your hormones. So each week I see several different clients, especially women, and they come in with different issues, things that can be easily reversed and resolved. Somehow we have an addiction to the sugar and the flour. We feel that we just have to eat it. The bread, some of us feel that we need that too. And things like milk. I had a patient just this week who felt like she could not do without the dairy. Now, granted, she's having bloating, she's having constipation, diarrhea, her stomach is like very full. And it's mainly the milk that's causing it, but because she doesn't want to give it up, she's not even relating it to the milk. So after we have gone through the talk and so forth, she's trying it out of trying to stay away. Sometimes it's a mindset thing. It's just that dairy to color the coffee, or maybe the 3-in-1 to color it and the taste, but really it just needs to be put to the side because it's causing a lot of disruption to the body. Other hormone disruptors are alcohol, caffeine for some people, environmental toxins, which sometimes we can't do anything about. We just try and put plants around so that we can breathe fresh air. Stress, lack of exercise. And on this program, I'll say movement, because we all just need to make sure we're moving as much as possible. Of course, do's and don'ts of coping with menopausal anxiety. You want to get regular exercise and regular movement. What does that look like? That's moving 5 days a week, 5, not 2, not 3, but 5. And that could be getting in your 10,000 steps, dancing, just moving, because many of us have sedentary jobs. And unless you make an intentional effort to have a stand-up workstation or move every 10 to 20 minutes, go downstairs, go upstairs, do some jumping jacks, do some planks in your office, we find that we don't get exercise. And then not only drinking too much alcohol, but just staying away from the alcohol will decrease the night sweats, and allow you to have a proper, deep, rejuvenative sleep. Because one can sleep and wake up and still feel tired. So depending on what you're taking in, makes a whole difference. So how to get rid of the excess estrogen in the body? It involves self-care. It's not always about food, but just some little things such as self-care. It could be going for a walk, reading a favorite book. I'm sure on Menno Haven at some point we will have a book month. So I'm looking forward to that. It could be taking a bubble bath, maybe getting a massage. It could be just eating clean, calling a friend, calling a sister, getting a pedicure. It's the little things that count. Playing your favorite song, writing a letter, all these different ideas for you. Maybe you need to color or draw, just something to just bring down that stress level. Declutter your home, do some meditation, take a midday nap. Naps are magical. So just some self-care activities that help to reduce stress. And then creating a routine, an action plan, just being so intentional with things. Listening to your body, how you feel when you wake up, your energy levels, and some action and intention with maybe your morning routine. Do you have one? Are you doing like prayers, meditation, water therapy? For those things that you need to know 40 and above, for some women, they're just starting their childbearing years, but having that time out for yourself really matters. And I know as women, we tend to take on the world and we're like super moms. I was one of those super moms who felt like my husband could not help me. I will do it all myself. And then I had a hard lesson and I had to learn the hard way. And now I'm like, my dear, you can do it yourself. You'll have to do it yourself. I mean, if something happened to me, you'll just have to get on with it. So I have learned to prioritize things. I've learned to say no. That's one of a big thing for women because we say yes to everything, but learning to say no and your no being okay and you being okay with it and it not being a guilt trip. So in the morning, special routines such as the prayers, the meditation, the water therapy, the stretching, the movement, the exercise. And some women will say, when are we going to do this in the morning? Because you're like running helter skelter to get to work. But if you go to bed on time, you'll actually wake up calm and you'll be able to do these things here. And then, of course, action and intention with the movement. Wear a pedometer. Make sure you have a pedometer on so it helps you with accountability. Get your 10,000 steps in. Your water therapy through the day. I find that a lot of women are just dry. And that dryness, of course, is dehydration. Even the complaint about being dry for intimacy, dehydration. So if you are drinking your water, and many people, especially rainy season, you're not called to drink, but if you put lemon or cucumbers in your water, it makes an amazing difference. And you tend to drink the 3 liters with no problem. And you see that the body is just hydrated and it just feels good and your joints are fine. So if you infuse your water, it actually makes a huge difference. And then meal prepping, so you're not stressed out. You come home, you have to think about cooking food. If you meal prep ahead of time or you have someone at home who is able to follow your meal plan, maybe a meal plan from Carib Health. And once you follow your meal plan, then that person can help you just meal prep and all you have to do is warm up whatever it is that you're taking in. And then do you have a special bedtime routine where you're doing like your self-care time, your deep breathing, having some essential oils, whether it's peppermint oil or lavender oil? You want to just create your whole royal room that makes you feel good and able to sleep with ease. Even the self-care, taking time with your bath, your moisturizer, your natural products. And then if you think that you're having a nutritional deficiency or you're not even sure, you just know that you're not 100% yourself, you can come to Carib Health, have a nutrient analysis test. This analysis test actually scans the body and picks up the nutrients that are deficient. And once you raise those nutrients through food and supplementation, or maybe infusion therapy, it makes a whole difference. Like it's night and day. And the supplements that if you tend to go out yourself, you just want to make sure you're getting plant-based supplements. Be careful of supplements. Don't just take it for taking sake. Make sure that it's plant-based. And then I mentioned about detoxing. So if you're having symptoms of gut dysbiosis, where you are bloated, constipated, diarrhea, you're having regurgitation, reflux, you may just need to give your body a rest from all the foods, all the stress, and just have uh, a alkaline detox or a regular detox where it's just you taking juices for about 3 days. And of course, taking juice is under supervision. You don't want to just go out and just be taking juice. You want to have a guided program and make sure that the juices are all natural and curtailed to whatever it is that you're going through. It makes a difference because the detox will help you with reducing the stomach fat. It will help clear excess toxins from the blood. Also, as we're clearing toxins, you're also clearing them from the brain as well, and then helps you with sleeping well, helps you with regulating your bowel system. It's just overall improvements. And then moving on to getting rid of excess estrogen within the body. And this is those xenoestrogens. So if you're eating cruciferous vegetables, say you have high cholesterol or the estrogen dominance, as we mentioned, things like the purple cabbage, the greens, the water leaf, the spinach, the yanapaja. I know that these are that are on the screen are more European type vegetables, but some of these we do have available here in Nigeria. And then certainly our native vegetables make a huge difference as well. All right, practical tips to keep balance. We're wrapping up. Practical tips to keep balance would be ensuring that your consumption of water is optimal, 2.5 to 3 liters a day, and you're starting your water as soon as you wake up in the morning. So that water should be beside your bedside. And then throughout the day, you could put lemon in there, you could put apple cider vinegar, you could put cucumbers. Of course, foods that increase estrogen, if your estrogen levels are low, just including things like your nuts, your seeds, your grains, your millets, the vegetables, as I mentioned, the purple cabbage, your fruits that are in season as well, and then maybe supplementing with hormone regulating supplements, and also herbal teas. And then foods that balance your hormones, your flaxseed, your chia seed, your omega-3s, your avocado, your sweet potato, the leafy greens, the coconut oil, the ACV. And then, of course, all these green veg, the nuts, the grains, all are available in our society. So we have sesame seeds. That also is really high in vitamin E. It also helps for your bowel movements, the chia seeds, spirulina, your watermelon. All these things that you have at your disposal are all natural ingredients. And these help to regulate your hormonal levels. Eating clean, salads with all meals, the bell peppers, the celery, the carrots, the cucumbers, all of these, especially if you're able to go to the organic farmers market. And of course, as I mentioned, the ugu, the yanapaja, the ewedu, just ensuring that you're taking in these green vegetables so they can also help your iron levels, your B12 levels, and then nourishment for your body, and that includes the movement. So as you're moving, you're helping your digestive system, you're helping the circulation, you're helping your brain health as well. So movement in any way, whether it's dance, walk, strength training is super important. And I know we're going to have a webinar on that. So stay tuned. And then just in conclusion, good health starts with hormone balance and how hormones affect nearly every process in the body, your blood pressure, your sleep, your emotions, your mood. And just to give you an overview of some of the services and products that we provide at Carib Health, as we're a wellness center. The nutrient analysis, everything is customized. So it's not a one size fits all. Targeted supplementation, if need be, customized meal plans, palm, which is a blend of coconut and cold pressed palm oil. And that really helps to hydrate the cells, helps especially with intimacy. Evening primrose oil, natural soaps, lemongrass oil, body butters. We have a wellness experience that I know Menohaven is going to tap into, staycations. So ladies, you really need to treat yourselves and prioritize your health as much as possible. These are other services that Carib Health provides for disease reversal, holistic therapies, and so forth. So, in conclusion, there is always a price to pay. You either paid upfront with good wellness behavior, or you pay it later when illness shows up. And guess which costs more? So by prioritizing the tips mentioned, you can proactively maintain your health and well-being. Follow us on Instagram at Carib Health NG. Definitely, if you come for consultation, then we will give it to our Menohaven community. And I'll just pause there for any questions or clarifications or anything that you want to highlight. Thank you.
Okay, thank you very much, Mrs. Cherise, for that. That was a very wonderful, enlightening presentation. Truly appreciate you for that. I'm going to first of all start with the questions from the community that were dropped beforehand, and then afterwards we're going to go to the questions that are on the chat box. So if you haven't asked your questions, now is the best time to do that. So just drop whatever question you have for Mrs. Cerise in the chat, and I'm going to come to you shortly. Okay, so the first question is what type of food, vegetables, and fruits do we need to eat to ease off the hot flashes and insomnia in respect of menopause?
Okay, some of them I highlighted, but when it comes to hot flashes, you do have to ask yourself, are you drinking alcohol? Are you exercising? If you're exercising actively, you may not have the hot flashes. And if you are drinking alcohol or taking caffeine, that can also cause the hot flashes to come about. So if you're taking in things like cucumber, taking enough water, taking enough lemon water, usually the hormones just kind of balance out and it may not be so pronounced, those hot flashes. So try and take in as much natural food as possible, eliminate the alcohol, the smoking, and the processed foods.
Okay, the second question, I think you kind of answered it a little bit when you talked about Carib Health's plan, not a one size fit all. This person said, is a one size fit all nutrition, or is nutrition a one size fit all, or would blood groups and other genetics play a part in what nutrition they should choose?
I will say that certainly not a one size fits all. And when it comes to genetics, we definitely look at family history, but always know that genetics is just the train track, and your lifestyle is what kind of stimulates those symptoms to occur. So it's all about lifestyle, and then, looking at your medical history, whatever is going on there, but it's definitely not one size fits all.
Okay.
Okay.
Next question. What natural or alternative remedies can mimic the HRT in menopause?
One, I think that with the hormone replacement therapies, one, we need to look at what exactly is going on your hormonal profile, what's high, what's low, look at your health in a holistic way. So me saying like blueberries will do it, or um chia seeds will do it. That's just definitely not the answer. It has to be a holistic approach to see what's really going on. Hormonal therapy isn't so popular on our side of the globe just because studies and researchers have shown that it can predispose you to cancers or predispose you to other ailments. So if we take it as a holistic approach and look at what your baseline nutrients are and what you need to improve on, then we see that things balance out. And improving also could be just on the strength training. I mean, there's, as I mentioned, under the pillars of wellness, doing things in an intentional way helps to balance out the hormone. You actually may not need that hormone replacement therapy.
Okay, thank you very much. You've answered the question on hot flashes already during your presentation. Okay, so now we're taking questions from the chat box. First question, what natural diet can one use to correct hormonal imbalance in menopause?
Yeah, so that was basically the whole presentation. So clean eating. So you're paying attention to what you're eating, what you're not eating. So a lot of women will come in and they will say they're eating the same thing all the time. And if they're Yoruba or maybe they're Igbo, they will stick to only this food group. Maybe it will only be beans. And what we're saying for hormonal balances is that you have to diversify your vegetables, diversify the legumes. So, we have brown beans, we have white beans, black beans, red beans, we have the kidney beans. We tend to only eat the brown beans. So you're not getting all those B vitamins that you need when you could get zinc and copper from other things as well. And so when we look at nutrients, it's almost like an orchestra, a harmony, not just one nutrient that fixes one thing. So when you come to us, we do the consultation, we look at variety of foods and then encourage you to eat what's in season, eat the colorful vegetables, do away with the processed foods because that's what's also robbing your nutrients and causing imbalances. Hope that
Okay,
answered your question.
okay, I really hope so. Next question, please explain strength training. I do a lot of aerobics. How do I get rid of loss of tone or collagen?
Yeah, so aerobics, you know that you're doing like a lot of cardio, but when you're doing strength training, you're actually using certain weights, whether it's 2 kgs, 4 kgs, 5 kgs, and you're working different parts of your body. You can even do strength training with just using calisthenics, where you're using your own body weight. You don't have to lift weights to do strength training. So you can use your own body weight. So you would just either go to a gym or you could use a YouTube video that shows how to do the calisthenics. And that actually helps to bring tone to your muscles. And it also helps to rebuild the collagen levels as well. And then, of course, there are collagen supplements that you can take side by side and just make sure you're getting enough protein as you're doing your workouts as well.
Okay, thank you very much. Next question. What about skin tags? What causes it and how do you get rid of it?
Ah, Honorable Amina, unfortunately, I'm not a dermatologist, but I have seen women as they get older with these skin tags. Um, the dermatologist I know uses different methods. They use like a matchstick method. This is a special matchstick, of course. And they just kind of tap it and it falls off. I'm not sure what the thing is that's on the top of the matchstick, but I'm not a dermatologist, as I say. However, the skin tags can be excised without any pain and quite easily. And I do see many older women with it. I have no no idea what causes it, to be honest. I really don't know. It might be age,
Okay.
I don't know, or it may be a deficiency. I would look that up. Yeah.
Okay, so if it works, can you please share the details of a dermatologist that you know on the community so that they could
Oh,
reach
okay.
out to them? All right, thank you.
Yes,
Um,
definitely, definitely.
Next question. What brand of essential oils do you suggest? I use doTERRA oils and supplements.
Okay, doTERRA is an excellent brand. They have these cute essential oil bottles that are very concentrated, so you only use a little. There are quite a few different brands that have essential oils. Carib Health has, FD Natural has, and these are local. doTERRA, I know, is, I think, international, but they do have reps in Nigeria, and they have great products. So essential oils such as the lavender, they have different mixes, but they work, and they are also great for just relaxation and inhalation.
Okay, next question. Is walking enough exercise?
Walking is good exercise, but it's not enough. So sometimes you find that your body tends to get conditioned to one exercise. You've been doing that same walking for the last 2 to 5 years. You need to do something different because seems like nothing has really changed much. And that's where we say do the strength exercising, or you could do walking and aerobics. You could do stationary cycle. You could do swimming. You want to vary your exercise so that it works on the different muscle groups of the body. So varying the exercise 3 days a week, maybe you walk 2 days a week, strength training, or vice versa.
Okay, that answer also covers the person that asks about the types of exercises. So let's go to the next question. What can you take naturally to lower high cholesterol?
Yes, Wumi. So yes, all right. So when it comes to lowering your cholesterol, definitely the cruciferous vegetables. And I will say that though I'm telling you all a lot on this webinar, because remember, I'm a nutrition consultant, so people come to me for cholesterol issues. One of the things that we do is find out what exactly actually causing your liver to overproduce cholesterol, or what are you eating that is causing the cholesterol levels to just stay within the bloodstream, that fat to just stay within your bloodstream. Are you exercising? Are you not exercising? Are you taking in red meat, prawns, crayfish, snails? But things that help to lower your cholesterol naturally is the cruciferous vegetables, lots of water, and then the exercise, and then of course eating lean and clean.
Okay, final question from the chat box, please. How do you deal with sweating and heat in the body that could be very uncomfortable?
So of course you would wear cool clothing. You would make sure that you have that fan in your bag just in case. But wear cool clothing. So that means you're not wearing polyester. Polyester is a problem because it will help, it will cause your body to heat up. So as much as you can with linen, with cotton is best. Wear clothes in layers so that you are able to take off one layer if you need to. Have your fan, and then at night, make sure that your room is cool, and in your office, make sure that the room is cool and dress comfortably. Ladies,
Okay.
I'll say also something that can just make you have an instant hot flash. This afternoon, I went with my husband to an 80th birthday party, and one of the ladies just was walking up the hill, and I could tell she was struggling. I mean, I feel like myself, I'm at an age where I need to be comfortable. So I'm not going to wear the stiletto heels. She looked like she was older, but she was struggling with the heels, trying to go up the hill. She was sweating profusely. Just wear comfortable clothing. I just don't get it with, anyway, sorry for that personal rant. Wear be comfortable, just dress comfortable. And if you need to put your slippers in your bag or your track shoes in your bag and take out the heels when you get to the table, So you can look cute then do that.
Okay, so this question just came in, and I'm not really sure you could respond to it because it seems a little bit more medical and not really nutrition. But if you can, how do you deal with benign breast cysts? Is that the correct pronunciation of that?
With thinning,
Breast, yeah.
how do you deal with benign breast cysts?
Okay, benign.
Okay, Adiola. So when it comes to maybe you're taking a bath, or maybe you're still having your periods and you do a breast exam. You do that breast exam and you notice that you have a little lump. Definitely, yes, you go to the doctor. Sometimes the doctor will excise it. They will test it and check, is this cancerous? You can use the essential oil. It could be the evening primrose oil. It can also be castor oil. So if you find that you have fibrocystic breasts, you just put castor oil is the only oil that crosses the skin barrier and reduces inflammation. So you take that castor oil and every morning and evening, you rub the castor oil on that lump or that little cyst that you have there, and you'll see that gradually it will go down. Okay?
Okay. It seems
Yeah.
that we're having more questions. I'm only going to take the ones that are in the chat right now. Any more questions that you have, please drop them in the community because we've used like a lot of time on the webinar, especially the person that asked a comment about the crayfish and also menopause influences in high blood pressure. Please drop your question on the community, and Mrs. Cherise will get back to you as soon as she can. Thank you very much for the presentation today. Please do appreciate our speaker for today. You can always reach out to her via Carib Health. You could also pay her a visit if you're in Lagos. Carib Health is located at Ikoyi in Lagos. You can go there and you can consult her for anything that you need with regards to nutrition, with your health, and she would be there to help you. And also, do well to drop your feedbacks on the community on how you felt about the webinar today. That would be very, very good. Okay, Mrs. Cherise just dropped the phone number for Carib Health in the chat. You can copy that right there. And she's also going to drop the phone number for, I think, the dermatologist on the community. So if you haven't joined the community, do well to do that. Thank you very much for joining the webinar today. We still have a lot of exciting things coming forward on the Menohaven community. Mrs. Cherise mentioned that we're going to have a wellness experience, and that is going to be coming very, very soon. And of course, there's also the Meno moves just teased earlier. So thank you very much. I'm going to give the floor now to our founder, Mrs. Yinka, to give a short talk.
Okay, thank you, Antonia. It's not a talk. I just wanted to say thank you to Cherise. Thank you very much. This was a very educative session. Thank you for your time. And thank you for your support all the time. And I would like to just say to the ladies, especially those ones that are in Lagos, and if you'll be visiting Lagos anytime soon, to please stop by Carib Health. They have a full garden, what should I call it? A garden where they have all of these vegetables that she mentioned. And of course, if you have, people who sell organic vegetables around you, please feel free to visit them as well. Thank you so much. Even though I also had that question about the crayfish and the snails in particular. You say those are good for us. Is she still on the call? That's just a quick question. Are you saying?
I'm saying that those who have high cholesterol, anything that's shellfish, crayfish is under that shellfish. So if you find that you've eliminated the prawns, the red meat, and your cholesterol is still high, you may not need to eliminate crayfish,
but no worries.
You may need to eliminate the snail. Yeah.
Okay. All right. Thank you. And thank you so much, ladies. I mean, we couldn't have had this webinar without you joining, as in it wouldn't have been as much fun. So thank you so much. We have so many other things that are coming up. We have the wellness experience that we're going to have in July, beginning of July, we're going to have a webinar. As she said, we'll have a physical expert, a trainer who will talk to us about exercise. We'll have someone who will talk to us about skincare and things like that. So there's plenty on here. Please join our community, spread the word, and we're here to learn, and we're here to improve our lives and our health. Thank you, everyone.